You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, pain management from a physical medicine standpoint. If you are in pain, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Mark Bouffard. We've invited Dr. Bouffard on the program today to discuss pain management from a physical medicine standpoint. Dr. Bouffard, welcome to the program.
Thank you for having me, Randy.
Now, before we get into today's topic, let's talk a little bit about your background, your training, and I guess you're the newest physician to join the Dr. Reinhardt team.
Yes, I am. I just started this past September with Dr. Reinhardt. I come from a different background than the rest of the physicians we have there. I'm a physical medicine rehabilitation specialist that did a
That's physiatrist, is that right?
Physiatrist, yes.
Okay.
And then I did a fellowship in pain management at University of California, Davis. So there I have subspecialty training.
Now you come from a family of physicians,
yes,
is that right?
My father's a radiologist as well as my uncle. So I grew up around X-ray machines, X-ray images, seeing all these diagnostic exams.
So what is a physiatrist?
Physiatrist is a physician who tries to help patients restore their function. And
what does that
means trying to get them back to doing the things that they want to do. It could be simple things as getting in and out of a car, playing with their grandchildren, playing golf, playing tennis. You know, that's what we see here in the desert a lot, is people that want to get back and do their things that they enjoy.
Now, I talked to Dr. Reinhardt before this interview, and he said this was the guy, Dr. Bouffard was the guy that we needed in our practice. He was the missing, to complete this comprehensive care.
Correct.
So how does your training, or what is your role there?
Well, I work closely with physical therapists. I not only just try to eliminate the patient's pain, but I want them to get stronger, to do the things that they want to do again. So I will prescribe physical therapy as well as do medical management and interventional management, and sometimes even surgery.
You speak in terms of interventional procedures.
Yes.
Define that. What is that?
Well, after completing my residency in physical medicine rehabilitation at Baylor College of Medicine and University of Texas, Houston, I attended University of California, Davis for a interventional pain management fellowship. So I did another year of learning how to correctly do interventional procedures, which are needle placements in the pain generators.
Okay.
So, avoiding critical structures and just getting the medication where it needs to go.
You're hands-on. I mean, you touch the patient.
Yes.
As a physiatrist.
Yes. That's a big part of physiatry, is actually the physical exam. I remember a patient that I had in my training where she came to us complaining of severe neck pain. She has a diagnosis of rheumatoid arthritis. But while I was examining her, she started crying. And
Really?
I asked her, did I hurt you? Because that's what I was scared of. And she said, no. She goes, it's just that you're the first physician to ever touch me. She goes, I've been having to go to Mexico to get my medication because all the other doctors around here think I'm just asking for more drugs.
Okay.
So I determined that.
So touching a patient, the part I'm not catching here is what are you learning from touching the patient? Are you looking for does it help you diagnose or find the pain generator? What is it?
Yes, it helps me diagnose the pain generator. Because not only, just because you have a bulging disc doesn't mean that's what's causing your pain. Your pain could be coming from other sources, such as arthritis of the spine.
So you poke around?
Yeah, poke around, make them move, and see what's weak. So it helps determine what is causing their problem. Is it just arthritis or is it nerve damage?
Does it surprise you that more and more physicians that are doing pain management aren't that hands-on? I mean, based on your training?
Yes, because time constraints in all our practices now. I mean, we need to see our patients quicker, but that's not my approach. My approach is to do the right thing. And
okay.
I need to do hands-on.
Now, what kind of patients do you typically see?
Oh, I see all of them. I see, patients that were just acutely injured from lifting up a heavy object a couple days ago. I have post-stroke patients that have central pain syndrome. I have amputation patients with phantom limb pain. Then I have, some pediatric patients. We have cancer patients. So basically anybody in pain. we can see.
Now you say you have a comprehensive center.
Yes.
What does that mean?
It means that we do it all in our center. We not only treat our patients with medications, but then we can do other injection techniques. So we can eliminate the side effects by putting the medication directly where the pain generator is. We can do epidurals, we can do selective nerve root blocks, facet joint injections, spinal cord stimulators. So there's truly a large amount of procedures that we can do in our own facility.
Okay, let's talk about the different types of pain
Yes.
that you see.
Yeah. You know, that's what I learned in my training was that, you know, when people say they're in pain, a lot of people think, okay, you're in pain, give them some narcotics. That's not true. Learned that there's two different kinds of pain. There's tissue pain, which heals on its own, and that's usually described as a sharp stabbing pain. And then there's the nerve pain. You know, that's described as burning, tingling, pins and needles, and narcotics don't work for that type of pain. For example, I had a patient that was in the hospital. I got consulted on him. You know, the surgeon was getting frustrated because he kept giving him more and more morphine, wasn't cutting his pain. You know, just kept complaining he was in a lot of pain. I go in and see him, and I ask him, I'm like, well, I understand you just had your toe amputated, but what kind of pain are you having? And you know, I was expecting to say the sharp stabbing pain. He said, no, because I have burning pain down my legs. I'm like, well,
so what does that mean to you?
To me, that's nerve pain. You know, the narcotics is great for his post-surgical pain, but the nerve pain, he wasn't being treated at all. He wasn't on any medications for nerve pain. I started him on 2 different medications for nerve pain. Within 3 days, he was much improved, and he got discharged within 5 days.
Now, you say that the pain patient is undertreated.
Oh, yes.
You see a lot of it.
Oh, yeah.
You're passionate about that.
Oh, yeah. I mean, there's a term in pain management where they're termed pseudo addicts because, you know, they're being seen by their doctors as coming in all the time asking for more and more narcotics.
Okay.
Well, the problem is they're giving the wrong kind of medication. Sometimes they're giving them short-acting medications, which only last for 3 to 4 hours.
Are there a lot of people out there that are in pain that they're just taking the wrong medications?
Oh,
in
yes.
your view?
Yes. Yeah, there's no reason you should be taking that much medication.
So get a second opinion? I mean, what do? Bring in their bag and they go to you?
Oh,
and
definitely
say,
bring in your medications so we can help you because, you know, you might be on the wrong kind of medication.
Do they need a referral to see you?
No, they don't. They can call our office.
Do you think not enough people get that second opinion? You know,
Yes.
They come
Yes.
in, they show you their meds.
I think a lot of people would benefit from a second opinion.
So you say they're undertreated.
Yes, I believe they're undertreated because, you know, my hat's off to the primary care specialists. They're very bright because not only do they have to keep up on diabetic management, blood pressure medications, and, you know, antibiotics, you know, now they're also expected to treat pain. However, you know, I mean, I have the luxury that pain management, that's all I do. So that's all
insurance covers this, and logically,
yes,
it seems to me that everybody, I mean, if you're in pain, go to a pain specialist.
Yes. You should because, you know, pain is now considered the 5th vital sign. So we are mandated by the state of California to treat pain. So, you know, anybody in pain should be treated for it. They don't have to suffer.
What do you say to the critics, you know, some of the guys that I interviewed that that will say, well, they're just throwing, you know, meds at the issue or putting Band-Aids on the situation. What is your response to that? I
like to show them the successes. I mean, you just don't go by the numbers of, you know, patients saying they're now down from a 7 out of 10 to a 4 out of 10. But what are they doing? Is he out playing golf again? You know,
are there a lot of those stories?
Oh,
people that haven't golfed in years, now they could golf?
Yeah, several. I have, and you know, that's great. But the ones that really get me are the patients that come back and say, you know, my grandkids were here for a vacation and I was able to play with them first time in a long time. And that's what really gets me. That's what I really...
Is your goal as a physiatrist getting people off of these medications? I mean, in your mind, is it to wean them off?
No. The medications are used in conjunction to help them accomplish the goals that they want, be it playing with their children, going for a walk, playing golf, playing tennis. You know, sometimes you just need medication to do that.
Okay.
And there's nothing wrong with that. So
A lot of people fear medication.
I have so
that
many
could
patients.
be out of pain.
Yes, I have so many patients that are scared of taking narcotics because they're scared they're going to be addicted to it.
So what do you say to that?
I tell them that they shouldn't fear that. If the medication allows you to do the things you want to do, then you should take it.
But are they stuck on those forever?
Not necessarily. Sometimes these conditions are just limited, by time. They will heal on their own, but you just need the medications to bridge that time.
To bridge the time, to allow the body to heal itself?
Heal itself, correctly.
Are there those patients that you see, weekly, that started on medication and they're off?
Yes, especially with the new technology that's out there now too, with the spinal cord stimulators.
Okay.
Some of the patients that I've treated came in with a lot of medications, but now they're getting a spinal cord stimulator that helps relieve their pain, that they're able to come off their narcotics, and some of them may actually have disappeared from the practice.
Physicians watch this program.
Yes.
And since you're the new physiatrist in town,
yes,
that everybody's talking about, by the way,
well,
what do you want them to know about you?
That I'm not only a physiatrist, that I'm a pain management specialist, fellowship trained in pain management.
What does that mean?
I took an additional year to train how to care for specifically pain patients with both medications, the injection techniques, and even surgery. So, I didn't learn these things on the job. I actually did this another year of training.
Where'd you do your fellowship?
University of California, Davis up in Sacramento. So
Okay.
it's one of the very comprehensive pain management fellowships, and very busy.
And what about the weight? Dr. Reinhardt said that that's almost a thing of the past.
Yes, that's we're getting much better at that. Since our staff knows that pain is an emergency, we will see patients that day. And typically we'll see, a handful of patients, anywhere about maybe 10 patients a day. They just call that day because they are in such horrible pain they need to be seen.
I found somebody, by the way, I found myself defending you guys the other day because they were saying, well, I waited 2 hours. I was they treat pain as an emergency. And I said, well, the fact is that you could either be in pain on your couch for a week and get an appointment and get right in, or you could go in the same day and wait for a couple of hours and get out of pain.
Yes, that's true.
And that's true. Is that right?
Yes, because other places where I've worked at, to see the physician, you were on a waiting list to get seen. And then from that time to get your injection would be another few weeks. So by the time you actually get treatment, you may not be in pain anymore. But since we treat pain as an emergency, you'll be seen that day. You might have to wait a few hours, but that's better than sitting at home for several weeks in pain.
Okay, now you've seen other pain centers before you joined the team.
Yes.
How is this superior or different? Or is it?
It is, because we really treat the patients the same day. A lot of other places that I've looked at, like I said, you were seen first, evaluated, and then came up with a treatment plan. And by the time you had that plan initiated, you may not be in pain.
Is it speedier?
Yes, it's speedier. We get our patients in, and if they need the injection that day, we'll do it that day.
Why do you like the pain patient?
Oh, I just like seeing the results of the management, seeing them do the things that they want to do, hearing the stories that, I was able to go on that trip to Europe that we booked several months ago, and I was scared I wasn't going to be able to go. But now I went, and it was a great trip.
Okay, we're going to take a quick break.
Okay.
Patient watching this,
Yeah.
they're in pain, they're living with it.
Mhm.
What do you say to them? And they're afraid of narcotics, or they're afraid of these injections, or stimulators, or whatever. Or they think they've tried everything.
Well, I think they should come in for a second opinion, because not only do we use medications such as narcotics, there's a lot of other medications that are not narcotics that we can use. And there's other injection techniques or surgical procedures that may benefit.
Do you ever hear patients say, this is a completely different experience
Oh, yes.
than I've had elsewhere?
Yes, I just, the other day, had a patient call me up on Saturday, said that they were leaving town on Tuesday and needed and was wondering if I could see him. I said, call us Monday. I saw her Monday morning, gave her the injection that afternoon, and they're out of town now.
And they're happy.
So they're happy.
Now, I'm not trying to, promote you guys too much, by the way. I'm just asking the questions here.
Yeah.
But I think this is one of the things, because pain is such a serious thing that we invite you guys on the show because people are suffering that don't have to be.
Yes.
And I know I've visited your office, and I'm convinced that you guys are doing a fantastic job.
Yes, I think we are too. I think the success rates that we've had is great. Patients are very happy, and they like the care that they're getting there.
How do people decide or choose, or how do you guys figure it out? You got Dr. Reinhardt, Dr.
Yes.
Ruth, Anderson, and you. What do they do?
They can call and make an appointment for any of us, but if they are calling just to see a pain specialist, we'll try to get them in as soon as possible, whoever has an opening the soonest. Otherwise, they can request one of us.
Okay, we're going to take a quick break.
Okay.
When we come back, more about the process, what somebody can expect that's in chronic pain, what happens on day one, the evaluation process. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with physiatrist, pain management physician, Dr. Bouffard. We'll be right back. Hi, we are on location today. I'm Randy Alvarez. We're going to meet Dr. Bouffard, one of the physicians here at Dr. Reinhardt's office. He is expecting us. Hey, Dr. Bouffard, how you doing? You're going to show us around today?
Yeah, why don't you come in, I'll show you around our clinic.
Okay.
Some of our office staff here that...
All right, I've seen them before.
Yep, when they first come in.
So these are the patient rooms over here?
These are the patient rooms. We have 4 exam rooms,
Okay.
which are dedicated to just our patients to help. They come in, give us our history, tell us where their pain is. We examine them,
Okay.
and then evaluate whether medications or injections would be the appropriate course of treatment for
Okay,
them.
so this is
one of our exam rooms.
so patients obviously come in here for all types of
Yes.
any pain problem.
Right.
Okay.
Then they come in here, we take their history,
Okay.
and examine them, evaluate them, and decide what's the best option for them, whether
Okay.
it being medications or specific injection techniques.
Okay, now you're doing mostly the injections
Yes.
or procedures, implantables,
Procedure.
things like that, or
Yes.
Dr. Reinhardt does that? Or you
Actually, all 3 of us, Dr. Ruth, Dr. Reinhardt, and myself, all do the injections.
All right, okay. So you discuss findings in here.
Yes, and it's not uncommon for us to pull one of the other physicians in and ask their opinion.
Okay, now I've been here a few times. I've never seen your ORs.
Yep.
So that's why we wanted to come
Yep,
today.
why don't we show you those
All
to
right.
you.
Okay, where are we going?
Down here.
Right here.
This is where we do all our procedures,
Okay.
from our injections to our surgeries too. This facility is dedicated to pain management, solely pain management. We only do our procedures here, so we will.
So how many rooms?
We have 2 surgical suites and 2 recovery bays.
Okay.
So
what is it you're doing? I mean, you do your injections in here,
injections.
always.
Yes.
This way. Oh,
Yes.
Is this the
Because-
OR over here?
Yes.
This is the recovery area.
Yeah, those are the recovery area because we are
All right.
using X-ray guidance. Because we are using X-ray guidance for our procedures. So we will use this X-ray machine to show us the landmarks of the procedure we're going to be doing, making sure we get the needle in the right position.
But Dr. Reinhardt said there's a lot of technique
Oh, yeah.
to this.
Yes.
He also secretly told me off camera he thinks he's the best at giving these injections.
He might be.
Is it really? I mean, really? I mean, that makes a difference.
Yes.
Okay.
I mean, having that kind of experience available
Okay.
is great.
It's all image guided now.
It's image guided.
Is that way it's done nationwide?
For the most part, it is. There's some procedures that you do not need image, but for us, we do a lot of our procedures with image guidance.
So for a block,
Yes.
how long does that take? I mean, they're in here for 10 minutes.
About 10 minutes per procedure.
Does it hurt?
Not if it's done correctly. I mean, if we use a lot of local anesthetic, numb them up, so it might be uncomfortable, but it shouldn't hurt.
Okay. And then what other procedures are you doing in here? Some of the bigger
in
procedures.
Here, we'll actually even do morphine pump implants
Okay.
and spinal cord stimulator implants.
Right here. Same
So-
imaging. I mean, everything is right there.
Yep, we have...
What is this? What is this I'm looking at?
Right here, that's the mobile C-arm. It's called the C-arm. And that's what produces the x-rays, and then we see the images over here.
So this machine, this is an imaging machine. What, it just
That's
kind
our
of goes
X-ray.
over the patient?
Yep, that's our video x-ray. Goes right over the patient. Shows us the bony landmarks that we use to guide our needle, so we get the needle in the correct space.
Okay. Now, one of the things that, and by the way, if you're just tuning in, I'm Randy Alvarez. We are right here at Dr. Reinhardt's office. Is Dr. Bouffard. He is a physiatrist, is
Yes,
that right?
yes.
And we have Dr. Ruth, Dr. Bouffard, Dr. Reinhardt, and this is where they do their procedures.
Yes,
Now,
it's all
most of the
right.
procedures, though, that you're doing, they're walking out of here. Is that right?
Yeah, they walk out.
So what I'm hoping to do is, on wellnesshour.com, is to film you doing some of these procedures?
Yeah,
Maybe
that would be
lower
great.
some fears with these
Oh, yeah.
with some of the patients that are afraid of the procedure. Is
Oh,
that common? Are they afraid of this?
Oh, a lot of times. And a lot of times, immediately after the injection, they'll say, when I say, that's it, we're done, they're like, we're done?
I've heard, by the way, they say Dr. Bouffard is very gentle.
Yeah, well,
That's right.
thank you.
Okay. So, all right. Okay. Well, let's. In fact, this is a nursing station.
Yes,
Let's meet
this is
some
a
of the staff. I hope we can meet some of the staff. Do they see these nurses, or you're behind the scenes?
Oh, no, they're in there. They're here. They're in the procedure room with us.
So the front office. I walked in. I said, I hope Dr. Bouffard is not nervous, because we brought the cameras, and they said, oh, Dr. Bouffard never gets nervous. He's a laid-back guy.
Yeah, well, thank you.
So you're like this all the time.
Oh, yes.
So patients. I mean, this is the kind of thing. I mean, nowadays with 3 of you working under one roof, do they request a certain doctor?
Some do.
Some do.
Some do.
Okay.
Yeah, but we're all interchangeable here. Our egos are not big enough that we're the best one. So if another patient wants a different doctor, that's great with us.
Now you have a big staff here. How many people?
We're up to 40 plus.
40 people, and it's just pain.
Right.
So this is like a pain hospital. I mean, it's big in here.
Yes.
I don't know if we were able to get that on camera. Anyway, if you're just tuning in, we're here with Dr. Bouffard. He's a physician here at Dr. Reinhardt's office. We're going to take a quick break, and we'll be back in the studio right after this. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're discussing pain with medical doctor, physiatrist, Dr. Bouffard. Now, you've joined, and for people just tuning in, you've joined the Dr. Roland Reinhardt team of physicians.
Yes.
Do you guys ever get together?
No, that's what's great about working in this office is that we all bounce the ideas off each other.
I mean, does Dr. Reinhardt ever call you in and say, "Look at this"?
Yeah,
patient's
sometimes
case?
with me doing the physical exam, I evaluate their gait. Sometimes he'll ask me to come in there and.
What is it? Their gait, their stance?
The way they're walking.
Okay.
Is it, which muscle groups are weak? Where do you think the pain generator is for that patient? And I bounce ideas off Dr. Reinhardt, who's been doing this a lot longer than I have.
You guys have a lot of different, I guess it's obvious, but you have different philosophies, different approaches, different opinions.
Yes, that's how come we can bounce these ideas off each other. If I tried a couple injection techniques and they haven't worked, is there a different approach that could work better for them? And Dr. Reinhardt and Dr. Anderson have that experience, and they can give me that input.
You do a lot of injections as well.
Yes, a lot of injections.
Now, where do you guys do your surgeries?
Oh, right next door we have Advanced Pain Management, which is a state-of-the-art surgical center dedicated solely to pain management. So that's where we do all our procedures and our surgeries.
Are there cases where patients go into you, they've had pain for many years,
Yes.
and through a simple injection or one of these simple procedures, it's gone?
Yes. Yes,
Yeah.
we've had that. Patients, especially the patients that had back surgery before, and they think, well, I already had back surgery, there's nothing else we can do. Well, I think they should come in, get an opinion, and work a plan of treatment with a physician, and there might be a different injection technique that could be better because their pain may not be coming just straight from the spinal column. It might be coming from the muscles around there, could be coming from a different joint. That could be their pain generator, so it's not really the pain from their surgery.
Now, we haven't talked a lot about this pain generator. Finding the source of the pain, I guess, is the key to the whole thing.
Yes.
How are you better at doing that today than you were just 5 years ago?
Right now with the injection techniques that we have, we can put the medication right where we think the source is. So the injections are not only therapeutic in that they help patient with their pain, but they're diagnostic for us too. Because if the patient gets pain relief from that injection, then we know that's what's causing their pain. If they don't get pain relief, then that's also good information because we eliminated that as a source of their pain.
So there are patients that they go, I tried injections 8 years ago, 7 years ago, but maybe they...
No.
Has technology changed?
Technology's changed. The research on pain has changed in so much that there's other techniques, other medications that might benefit the patient now.
Would you guys say that you're more aggressive at Dr. Reinhardt's office than most? I know it's a tough thing to answer. But do you think so?
I think so. Because
if you had to give me the inside scoop, would you say we're more aggressive?
Yes, because we not at least here, we're not sitting waiting for medications to work or not work. If you need an injection, we'll give you an injection, because that has the benefit of putting the medication right where it is, eliminate side effects from medications, because when you're taking medication by mouth, that medication goes all over your body. Okay. But with injections, we're putting the medication right where the problem is.
Is pain still being handled on a part-time basis at other centers? I know we promised not to talk or say anything negative about other centers, but does it happen? Is it still going on?
I would think so, because pain patients can be very time-consuming. So they may not dedicate enough time of their practice to care for chronic pain patients.
Okay.
So it's not being treated as aggressive as we do it.
Okay. Any misconceptions about what you guys do?
Well, a lot of people think we're just throwing some medications there, like you said, a Band-Aid. But that's great if they're also improving their function. If their pain is down but they can do more, to me that's a success.
Okay, I talked to Dr. Ruth off camera, and she says you guys are the dream team. You feel that way?
Yeah, I think we are.
And when it comes to pain?
Yeah, because we'll treat pain aggressively, and between the three of us, we'll if not one of us can do it, somebody else can.
Okay, and there's still a lot of people, thousands, probably more than 20,000 people that haven't tried you guys.
Yes.
In the what do you say to them?
Give us a call.
If they're still in pain.
Give us a call and come in and get evaluated by one of us, one of the physicians, to come up with your game plan of how to treat this pain. Because that's what's also different with us, is that when you're initially coming in for a visit, you will be seen by a physician.
Dr. Bouffard, I want to thank you for coming on the show.
Well, thanks for having me on.
A pleasure meeting you, by the way.
Thanks for having me on the show.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this program, this interview, again online, visit our website at wellnesshour.com. For now, I wish you good health.